So let's talk about paclitaxel and ramucirumab in some detail. So there was a phase 3 study that compared the combination paclitaxel and ramucirumab versus paclitaxel alone, and the combination did improve survival. The hazard ratio was around 0.8, so it's a 20% improvement in survival with the combination therapy. Ramucirumab is a VEGFR2 antibody inhibitor. The toxicity profile of ramucirumab is similar to what we see with bevacizumab, so hypertension, some bleeding risk, and that's what we saw on this study as well. We really didn't see a significant increase in perforation, which you did see with bevacizumab in the earlier studies. And we do see a little bit more lymphopenia with Taxol and ramucirumab versus Taxol alone, but generally the combination is pretty well tolerated with minimal added toxicity over what you see with Taxol alone. The one thing that you might consider is that patients who have significant neuropathy, you might need to question whether Taxol is the right choice, and so ramucirumab single agent might be considered, irinotecan might be considered. There's limited data of combining those two, although theoretically there really shouldn't be any problem with that. The FOLFIRI bevacizumab option, for example, is really quite active, and in terms of the efficacy, I mentioned the 20% improvement in survival. The response rates are about 20% with the combination. Ramucirumab has really no response by itself, but there is synergy when you combine them. Supportive care is a key aspect of managing anybody with gastric and GE junction cancer. So there are often issues of nutrition, neuropathy, and also sort of social issues related to depression or anxiety, coping, things like that. And that often requires counseling regularly during our visits. Often patients could seek help from social worker or group therapy sessions for that. From a nutrition standpoint, seeing a dietitian is important. Sometimes we do need to place a stent for proximal obstruction. Sometimes radiation is helpful. Sometimes a feeding tube is necessary. In terms of the neuropathy, there are medications that can help mitigate the symptoms of neuropathy. We commonly use gabapentin, Cymbalta, Lyrica, alpha-lipoic acid can help, but there isn't a great magic bullet for that. Those are, I think, the most prevalent supportive care issues, but many others exist.